What is cognitive processing therapy? Well, cognitive processing therapy, or CPT, is an evidence based trauma therapy that focuses on how trauma shapes the belief we develop about ourselves, other people, and the world after experiencing something stressful or traumatic. And rather than trying to erase what happened, CPT helps people understand how they made sense of that trauma while gently examining beliefs related to safety, trust, power and control, esteem, and intimacy. More on that later. But tell me, does this stuff resonate with you? Go ahead, drop a yes in the comments if these changes in beliefs sound familiar. You're not alone if they do. And real quick, before we go on, if you don't know me yet, I'm Dr. Jenny Hughes, a trauma psychologist and founder of the Brave Trauma Therapist Collective, where I support trauma therapists in doing the work they love. Now, coming back to the changes in beliefs that happen after we experience stress and trauma, this matters because after going through something terrible, scary, and horrific, people don't just remember what happened. They start telling themselves stories and narratives about what it means. Stories about whether they're safe as they walk down the street, or whether they can trust other people, whether they should have done something different, or if the trauma was their fault. And over time, those stories start to shape how someone moves through the world. They influence your relationships, decisions, emotions, and how you see yourself long after trauma is over. This is the space that cognitive processing therapy was created to work with. And like I said earlier, CPT is an evidence-based trauma therapy that was originally developed from cognitive behavioral therapy, CBT, to help treat PTSD. And like I said, at its core, CPT focuses on how trauma impacts beliefs about the self, others, and the world, right? And the central part of CPT is helping people identify where they feel stuck in their thinking after trauma, especially around those themes of safety, trust, power and control, esteem, aka how they feel about themselves and their worth, and intimacy, aka how are your personal relationships going, not just romantic ones. And as I name these themes, again, notice which one your body reacts to. And really, please listen to what I'm going to say next. Those beliefs or changes in them didn't just come out of nowhere. They formed as a way to survive, to make sense of something overwhelming, or to regain a sense of control in the aftermath of trauma. And CPT doesn't treat those beliefs as wrong or irrational. It respects the survival logic behind them, all while helping people gently examine whether those conclusions are still serving them now. In cognitive processing therapy, I talked about how you get stuck, right? Well, we use this term stuck points to refer to the changes in beliefs that happen after trauma. We define stuck points as the conclusions that people come to after trauma that help them understand what happened, but they may or may not be accurate or helpful. And people can literally get stuck in those beliefs because they can feel so incredibly absolute. These beliefs also help to close the loop. There are so many unanswered questions after trauma, and stuck points help to give answers to them, even if they are not necessarily accurate or helpful. Stuck points are the places where someone's thinking then gets frozen around what happened because they are giving this answer to unanswerable questions of how something so terrible could happen to you. A lot of times, stuck points are really all or nothing, black and white. They can even sound really harsh or critical towards yourself and others. And they often feel pretty darn convincing. Things like, if I let my guard down, something bad will happen. Well, it will, right? What happened is all my fault. I guess so. I should have known better. All those shoulds. I can't trust anyone. Whew, that's so much safer. I'm not safe unless I'm totally in control. Sound familiar? These stuck points tend to cluster around those really specific themes that I mentioned earlier. And remember, stuck points are not a sign that you're thinking irrationally or that there's something wrong with you. They're just a sign that the brain did exactly what it needed to in the face of trauma. It tried to make sense of something overwhelming and protect against it happening again in the future. Now, in CPT, when we're actually doing CPT, we're not trying to rip those beliefs away. We're first slowing down enough to just notice them, to realize that they exist. And then CPT uses structured practices and exercises to help people take that slowing down and then examine their trauma-shaped beliefs with curiosity instead of judgment. Therapists and clients work together to look at things like what evidence supports this belief? What evidence might not support it? How did the trauma shape this conclusion in the first place? And is this belief helpful or realistic? And this process isn't about arguing with yourself or being talked out of your experience. It's not gaslighting you out of your trauma and PTSD. And it is definitely not about forcing positive thinking. The goal is flexibility. We use this term cognitive flexibility in CPT all the time, which means CPT helps move people from rigid, all or nothing thinking conclusions to beliefs that leave more room for choice, nuance, and self-compassion while still acknowledging that the world is often unsafe and we're allowed to care for our needs. In practice, then, this is collaborative meaning making between the therapist and the client, not correction, because you and your brain haven't done anything wrong. Nothing needs to be corrected. Okay. Now, there are a few myths about CPT that come up a lot. One is that CPT is just worksheets. Yes, CPT is highly structured, and there's lots of written components and homework, but structure doesn't mean shallow. And for many people, that structure creates so much safety. And I see this a lot in my work as a trauma therapist. For some clients, they specifically want to start with CPT because it has this clear roadmap from beginning to end of the treatment. And for lots of those folks, CPT helps them get to their goals. And for lots of others, it's a foundational first step in their trauma work as we then integrate other approaches that are going to support their brains and bodies. Another myth is that CPT is too intellectual for trauma. Now, I get where this is coming from, as CPT is a top-down approach, so coming from the neocortex. You can watch my hand model of the brain video if you need more on that. CPT is a top-down approach, and really leaning into that smart neocortex and cognitive brain. Now, you've heard me say in the What is Brain Spotting video, you can watch that one too, that trauma is experienced, processed, and stored in our subcortical brain, which is a benefit of bottom-up approaches that can access those parts of the brain more directly. But that doesn't mean that top-down approaches don't work. And in reality, CPT can and is deeply emotional and somatic, especially when guided by a therapist who honors attunement and the therapeutic relationship first and foremost. And when you think about it, anytime someone begins to question beliefs rooted in shame, guilt, or self-blame, emotional movement will naturally follow. A third myth is that CPT requires people to relive their trauma over and over. CPT is focused on meaning, not repeated exposure. There are other interventions that are exposure-based, and I'll talk about those, but that's not at the core what CPT is. People aren't being asked to retell their entire story in order to heal, and they can share as much or as little about the actual details of their trauma and still have really great outcomes. So, who is a good fit for cognitive processing therapy? CPT can be super helpful for people who feel stuck in self-blame, guilt, shame, rumination, or looping thoughts that won't go away. For people whose inner critic just will not shut up. And it often resonates with people who want a clear framework for understanding what's happening internally. And it can be really wonderful as a first-line treatment for trauma and PTSD. For therapists out there, CPT can feel super grounding for you because of that structured way to work with meaning without invalidating emotion. And this is where it can help to contrast CPT with other trauma therapies, not to rank them, but to think about the different processes at play here. So, CPT, again, is primarily working through examining beliefs and meaning, whereas therapies like EMDR or brain spotting and any of those bottom up approaches work more directly with the memory through the nervous system. Okay. These are just different doors, different entry points, same goal, reducing trauma's hold on someone's life. Now, if you've been around me long enough, you know that I teach that trauma doesn't just live in memory. It lives in the stories we tell ourselves to survive what we've been through. Cognitive processing therapy gives people permission to question those stories without shaming themselves for having had them in the first place. And trauma work is never about being broken. It's about being human and trying to make sense of something that never should have happened. CPT offers a way to hold those meanings with more compassion and flexibility so they don't keep defining the future. And before we wrap up, I want to say, if you're a trauma therapist watching this and you're feeling the weight of this work, the self-doubt, the isolation, the emotional load, you don't have to carry that alone. You can learn more about the support and community I offer through the Brave Trauma Therapist Collective. Just head to my website, linked below in the description. And this place exists so trauma therapists can keep doing the work they love without burning themselves out. And if you're watching this as someone who's been impacted by trauma and you're wondering whether cognitive processing therapy might be a good fit for you, you can also visit my website to learn more about my work and reach out if you're looking for a trauma therapist. The link is below so you can explore what feels right for you.